Complacent and don't do really aggressive containment and mitigation, the number could go way up, many, many millions.
To be isolating patients, emphasizing social distancing.
Wuhan, China confirmed the coronavirus outbreak is now a pandemic.
That COVID-19 can be characterized as a pandemic.
In Italy, one of the worst affected countries, the pace
and business supply chains are being disrupted around the globe. This combination of people being unable to work, businesses being
And those
It's confirmed the coronavirus outbreak is now a pandemic.
I'm pleased to be speaking today with Dr. Sasa, the former Special Envoy to the United Nations and currently the Union Minister of International Cooperation and spokesperson of the National Unity Government of Myanmar. Dr. Sasa, thank you so much for joining us here today at Inside Myanmar podcast.
Thank you for having me.
So while there's so much to discuss concerning the events of the last 6 months, what's bringing us together now is the urgency of the COVID-19 pandemic as it's sweeping through your country. Of course, much of the world has already suffered from coronavirus in their own way in the course of the last year and a half. Yet, what Myanmar is now facing is very different from anything we've seen in any other country. For the past year and a half, waves of COVID have exploded across countries because events took them by surprise, or because of new virus mutations, or inadequate health systems, or even governmental ignorance or inaction. But in Myanmar today, with a challenging healthcare infrastructure to begin with, and the much more deadly Delta variant now taking hold, the situation is being seriously exacerbated by the military junta actively arresting physicians, forcing healthcare workers underground, and prohibiting the import of essential medical supplies. Against this aggression, the Burmese people don't really even have a chance. So this is just a little background on the situation. For those listeners unfamiliar what exactly is happening now in Myanmar in relation to the virus, can you give a brief summary of the current state of COVID?
Firstly, this military coup should never have taken place. In the first place, no one should have think of getting the power of the people of Myanmar by battlefield weapons and by killing the people. And when the rest of the world are attacking these killer, COVID-19, they are imposing social distancing, travel restrictions, lockdowns, etc., and working around the clock to save the people of this globe from this pandemic. But the military generals in Myanmar are just doing the opposite. They have no social distancing, they have no lockdown, they have no travel restrictions. So what basically happening the last 4 months is the military junta, after they take our democracy, has stolen our freedom and attack our people. They are setting men and women in uniform who should be protecting the people of Myanmar, to attack the people of Myanmar from village to village, from town to town, from city to cities, from state to state. So where is their social distancing? Where is their travel restriction? Where is their lockdown? So basically, this is, in the way, a very man-made humanitarian catastrophe, and the military junta is responsible for creating this situation with COVID-19 pandemic. Now we are facing the third wave, COVID-19 spreading across the country. It's out of control. And it is Delta variant. That means, who can promise that there will not be fourth wave? Who can promise that there will not be fifth wave or sixth wave? Because Myanmar is being created by the military junta to be a new ground for COVID-19 to breed. So who can say there will be no new variants that will be more deadlier than this variant that we are facing? There can be new strains of COVID-19, new mutations, because it's out of control. So epidemiologists and all the one who is expert with the virus, we all know, I'm a doctor, and we know how these things can quickly, the mutation took place if it's allowed like that. And so it's a it's a concern not only for the people of Myanmar, it should be a concern for international community, concern for UN Security Council. It should be a concern for WHO, concern for our neighbor, China, India, Thailand. Everyone should concern about this, because COVID-19 have no border, has no respect for borders, international borders. COVID-19 has no respect for political affiliation, have no religions, have no race. So it can quickly become out of control. So it's a very, very critical situation.
Are you in touch with any healthcare professionals on the ground in Myanmar? And if so, what are they telling you now?
Of course, the doctors and nurses and the heroes of the nations have been working around the clock where they are and with their own capacity. I have been in several contact with the people who are working on the ground situations, and then we have formed, as the government, we have formed COVID-19 manage control preventions commissions, and it's national level commission. And what's happening on the ground is the military junta that we are facing in Myanmar. They are attacking health workers, they are attacking nurses and doctors, and it is unbelievable, because without doctors, without nurses, no one can even give this COVID-19 vaccination to the people. This military junta in Myanmar that we are facing, they are simply, example I can tell you, like a few days ago, they like to arrest the doctors who are helping COVID-19 patients who are dying at their homes without care. So the military regime like to stop them doing so, because they expose them somehow. And they pretend as if they are COVID-19 patients, and they call those doctors, say, please come and help us. I'm not well. I have COVID-19. But the doctors turn up to help to wherever location they point out. It turned to be the military men and women in uniform. And they arrested the doctors straight away and tortured them, arrest them. We don't know where they kept. A few days ago, there's 12 doctors and nurses arrested, just imagine, in that way. They trapped to arrest doctors. And let me go back a little bit. the
Sure.
back. Like, when the military coup took place, the people of Myanmar, the doctors, the nurses, everyone, we all say enough is enough. We don't like to live under this killer. We don't like to live under these murderers who only bring death and destruction to the people of Myanmar. So when they do peaceful protest, peaceful movement, which is much more powerful than the military act of terrorism. So they strike and they refuse to work under the military boots because those military junta are the killer in Myanmar for many, many years. They are guilty of crime against humanity, atrocities, war crime, genocide. What happened to the Rohingya people? 2017, 2018. Those are the crime against humanity as the world watch the atrocities committed by the military junta in Myanmar. So these are the same people who committed crime against humanity. These are the same people who committed ethnic cleansings and atrocities, genocide against the Kachin people, the Shan people, the Mon people, the Kayans, Rakhine, Rohingya, Chin, name it. All of us are the victims of these murderers in Myanmar. So when the military took a power like that, people of Myanmar say it's do or die because there's no other way. And these doctors and nurses joined the most peaceful movement called CDM movement, Civil Disobedience Movement. Right from that time, they start attacking the doctors, the nurses, and the healthcare workers across the country. It's 250 records of attack on healthcare facilities, the doctors and nurses across the country. This is unacceptable. These are the doctors and nurses who should be protecting the people from COVID-19. But the military junta are attacking the one who are attacking COVID-19. So in a way, the doctors attack COVID-19 and the military attack the doctors who attack COVID-19. So any country in the world, they should be, we have got the armed forces in any nations in the world. Armed forces purpose and they swelled in to protect the people. But the military junta under the command of Ming Aung Hlaing are just doing the opposite. They are just attacking the people, attacking the doctors, attacking the nurses, attacking the hospital facilities. Now, all the hospitals are somehow occupied by the military junta. In the hospital, there are no doctors, there are no nurses, there are military weapons. So how can we do with this COVID-19 when our healthcare system has been ruined under the military junta?
Right. So that certainly is a distressing picture. And when we look at the start of the CDM movement, indeed, it was many of the doctors and nurses that led the way. And because of that, they have been under a special kind of persecution for their leading role in that movement. And as you just referenced, the military is using hospitals as well as monasteries and schools and other places to actually set up their camps all over the country. So hospital work is not getting done. This is quite a distressing picture that you paint of the third wave of the Delta variant of COVID spreading throughout the country and doctors being unable to help them to a large extent and the military persecuting the doctors as the disease rages on. So what can be done? How can this be responded to?
international community is the only answer to this problem, because the people of Myanmar have done everything they can, and in fact they are giving their life for the cause of freedom and democracy, and for the cause of protecting the people of Myanmar from COVID-19. And you see us across the country, the people are crying for oxygen. They cannot breathe. They are saying, we cannot breathe. We can't breathe anymore. And the military junta prohibiting and obstructing the people of Myanmar to get oxygen. They don't have, this military junta have no interest to protect the people, but all they prove is to kill the people. That's why they have killed nearly 1,000. Imagine, nearly 1,000 for the last few months. Those 1,000 people have been killed in cold blood. The victims, they have done nothing wrong. They have done nothing wrong. Mm-hmm. And they arrested now almost 7,000 men and women, including children. They arrest children, 4 years old children. Before, so those children were arrested after they cannot find their parents. So they arrest the children by thinking that the parents will turn up. They pray no. So these military junta actions is unacceptable, unbelievable. It shows how bad human being can be. It shows how bad things can be when it's evil. It's evil. You can only say it's evil. So now we have been seeing what evil means in this world. And they have issued arrest warrants to so many doctors, so many nurses, including me. They charged me with high treason. In the way, I'm proud because I stand up for democracy, the freedom and justice. They are the enemy of democracy. They are the enemy of freedom and peace. I stand for peace. I stand for love. I stand for the future. So they treated me as the enemy and charged me with high treason because of that. But in the way, it is funny that military junta, who are committing crime against humanity, high treason against the people of Myanmar, the country of Myanmar, have charged me with high treason. Just imagine that. So this is the situation that we cannot do it alone. Everybody have to come to board. Everybody have to come together. That means international community have to come together. Example, all the international community that's dealing with COVID-19 vaccination and COVID-19 control and COVID-19 related aids and relief, all the organizations around the world and the responsible government around the world, responsible international community around the world, everybody have to be on board. And we have to do this together. It is no way that the people of Myanmar will be expected to control and prevent this COVID-19 unless there is targeted, coordinated, and a strong support from international community, like oxygen. Oxygen is not something that the villagers can make. It's something that has to produce. And COVID-19 treatment, and PPE, and face mask. Most importantly, COVID-19 vaccination. It's not something that we can do alone. And that's why I'm calling to UN Security Council to do a strong and new resolution to call for ceasefire, COVID-19 ceasefire. We need COVID-19 ceasefire. We need COVID-19 pandemic pause. So no one should be thinking of getting guns and shooting the people when this pandemic is killing already millions of people around the world. So it's the UN Security Council to come together, realize that COVID-19 has no border. COVID-19 has it does not understand the UN Security Council or UN or religious or peace security. It kill. That's COVID-19. So in the way, if before the situation become too late, UN Security Council have to stop this military junta in Myanmar of their act of violence across the country. Let's say we bring COVID-19 vaccination and military junta came and attack. That's COVID-19 vaccination. We have every reason to believe that they will do the same again because these people are attacking the doctors and nurses. This military junta are attacking the doctors and nurses. So that is attack on COVID-19 prevention. That is attack on COVID-19 control. That's attack on COVID-19 management. It's very simple. And so UN Security Council must come with a new strong resolution calling for pandemic pause, pandemic ceasefire, COVID-19 ceasefire, so that these oxygen can be supplied to the people who are most in need. During that ceasefire period, oxygen supply will go into the people of Myanmar, and vaccination must be administered to the people of Myanmar without any military interference. Who can transport the oxygen and that COVID-19 vaccination with gunpoint, with smoky guns? That's not going to work. So we need UN Security Council to impose COVID-19 ceasefire immediately and now. Otherwise, it will be too late. By the time this COVID-19 Delta variant crossed the border to China, by the time this COVID-19 new variant that we are facing in Myanmar crossed to India, crossed to Thailand, and crossed to ASEAN, and reached to Russia and Europe and US, it will be too late. It will be too late. Therefore, this is the effort that minimum UN Security Council can immediately impose COVID-19 ceasefire now in Myanmar, where all the doctors, the nurses can work freely to protect the people. So they must allow the humanitarian pause. They must allow that COVID-19 ceasefire. Otherwise, no doctors, no nurses will come to be just bombed and killed by military junta without ceasefire. That's what could happen.
Thank you for that. And you reference how in the villages, in the cities even, Burmese people cannot manufacture or make what it is they need right now. They're in need of medical equipment and different medicine to be brought in safely to make best use of confronting the coronavirus pandemic. Can you detail a bit more specifically what types of medical equipment or medicine is most needed right now?
So this COVID-19 is something that is very new and the world have not understood properly yet. No one know the origin of COVID-19 example. No one know. We all assume and we all feel this is, so from laboratory or from, from Wuhan and laboratory or how, where, we just don't know. And all this new variant, we just don't know. All we can do together is there is a mechanism of prevention. Hand washing, everybody know how to wash hand, but they need the soap. They need the soap. There's no soap. And everybody know how to wear mask now, but there's no mask. And everybody now understood there should be social distancing, but the military junta are sending thousands of men with battlefield weapons in uniform across the villages. That has to stop because there's no social distancing. There are super spread of COVID-19 across the country. Yeah, those are very simple mechanisms. That has to be on the ground, and there has to be health education to the people. It has to be community-led approach, and the community has to start community face mask campaign, community hand washing campaigns, community lockdown themselves, lockdown by their own community. Like, we should not travel to that village or this village, because right now all the community has to be constrained, and they can go to the farm, the field, but not necessarily go out of the village, something like that. So that has to be implemented on the ground. And in terms of medicines, there's not really much, but how do we know that our body is able to resist somehow those COVID-19 recovery? So there's pre-existing condition. Let's say if somebody have high blood pressure, if somebody have diabetes, if somebody have all those pre-existing conditions, we should be identifying those conditions, who have it, who does not, so that we can give the best care to them. And then if they have the high temperature, then we need to have paracetamol to lower it down. The same way, if somebody have no food to eat, hungry is not good for virus. Our body must be strong and immune. Somehow, our immunity has to be strong. That means giving heavy enough nutrients to our body. That's the way how we overcome COVID-19 also. There's a recovery rate. Some 80% people who got COVID-19 recover because they are treated well in that situation. If there is dehydration, then there has to be rehydration. So all those things are the thing that the people of Myanmar need right now. Basic thing I can say is basic thing. We don't need to be a doctor to do that. Everybody can do that, and everybody have the responsibility to do that, but they need the resources. And this vaccination is critical because vaccination allows people to be immune to that virus, even if it comes. So this is the main focus for us. So we cannot also just give one part of the people COVID-19 vaccination and another community left behind. If that is the case, then that COVID-19 vaccination will not be effective, because the one who do not eject COVID-19 vaccination will be carrier of COVID-19, and it will be transmitted again and again to the population. So it has to be the effort of everyone together.
You referenced the help that's needed right now from the international community, from the neighboring countries, from the United Nations, and that's definitely true. In short of receiving that help, and for the time being, is there any potential plan, as far as you're safe and able to say, on the side of the NUG for being able to bring in and vaccinate themselves?
We are talking to international community, not just this time. Right from the beginning, Myanmar was a country that was able to control and manage the COVID-19 in early on, and we are in fact the first country that received COVID-19 vaccination from India.
Mhm.
And we have got a plan to be able to administer COVID-19 vaccination to 20% of our population by April this year. It was our plan, and we have got a really good plan, and we have got a really good strategy to roll out right from the beginning. But from 1st of February, the military junta wipe out our plan. And they kill it. They kill all the plant to control, prevent, manage COVID-19 in Myanmar. And what they do, they brought weapons, battlefield weapons, and kill the people. They do not bring COVID-19 vaccination. Military do not bring oxygen, but they kill the people. They bring the guns and weapons and bullets they bought with the money, stolen money from the people of Myanmar. And they bought those weapons from Russia and China and bring in and kill the people. That's what they're doing. So now, as we, civilian government again is attacked and is stolen, our democracy, stolen by them, smoky gun, what can we do? But what I can say is we are sacrificing our life to do this job. We are risking our life every day, every moment. And we are talking to international community with concerned bodies to provide vaccination. And I have sent a request letter to Gavi organization, CEO of Gavi. Yeah, Virgin Airlines, formed by WHO, World Health Organization, and under the program of Gavi, and that's called COVAX program. Yeah, COVAX program. So now, international community, through those concerned international bodies, we are receiving COVID-19 vaccination. We are about to receive, I must say, and some 4 million dosage of COVID-19 vaccination will be coming to Myanmar. And then the question is not about vaccines. The question is about how those vaccines will be given to the people of Myanmar when this God-poisoned military junta, men and women with battlefield weapons at large. They are roaming around the country to kill the people. So that's why we are saying important thing is ceasefire from military junta. And they must withdraw all those battlefield weapons from people, from the population, from private homes and village and city across the country, so that this pandemic can be managed and controlled. And we are also talking to international community like European Union, where they have got COVID-19 mechanism that can be activated under the request of the state government. But the problem, Myanmar, is that we have no government now on the ground because it's been occupied by military junta. They occupied us. So we are asking another international community bodies like ICRC, International Red Cross Committee, to be able to talk to like European Union on behalf of the people of Myanmar who are facing such difficult time. It's the darkest moment in our history. So I can tell you so many things that we are doing, but some of things that we are doing, I cannot tell in detail.
Sure. You reference what the international community could do if they step in. How about aid organizations, international aid organizations, and how about just normal donors, listeners to this podcast that would like to help in some small way themselves? What would be the role of individual donors and larger aid organizations?
This world is lucky to have so many people who have got really good heart and try to help the people who are in troubles and try to help solve the problem who have a problem. And there's so many charity or organization or church or monastery. I can tell you so many people are doing so many good things. So wherever you are, whichever community you belong to, I'm sure there's always a community and organizations or groups that are trying to make the differences. Please go and join those people or help those people who are trying to relieve the people of Myanmar from this suffering and pain. And there's so many organizations, you can say UN organizations or other non-governmental organizations and agencies. They are doing a lot of good things in Myanmar. There's CSO, community-based organization, and civil society organizations, NGOs across the country. It's filled with all these good people. So I request and appeal to all of the listeners of this podcast that please find out these organizations which are near to you and which are in your community or inside Myanmar, and support them in whichever way you can. Every support that you can give to the people of Myanmar through those organizations will be counted. It's about a glass of water. It's a price of glass of water. So glass of water matters in this moment. Glass of water to the people of Myanmar matters and value in this moment. That is how much we need the help from international community and from individuals around the world. And we again thankful to all the generous people who have been giving to relieve the people of Myanmar from this pain and suffering that they have been enduring so much for so long under this military junta.
Personally speaking, I'm thinking that you yourself come from a medical background, and I can't imagine what it must be like for you to be seeing this devastation now. I've heard that you became a doctor originally because growing up, you saw people in your community, in your local small community in Chin State, that were dying of treatable diseases, and you personally felt a conviction to become a doctor to be able to save these lives. So I can't imagine what it must be now to see a much wider community continuing to die of treatable diseases, given your own personal history.
I mean, the world have suffered enough, the world have suffered enough, and enough is enough. Now we have suffered too much. I have seen the woman die in childbirth, die in the labor. 4 or 5 days of labor. Imagine 4 or 5 days of labor in the bamboo houses and the kitchens in the jungle villages across the country. In fact, 75% of Myanmar population live in rural, remote area. 75%. Only 25% live in the place where there's a hospital or where there's a university or college. Just imagine that. And so, yeah, it is heartbreaking to see what's happening now. As a doctor, I'm grieving. I'm crying for my people every day. It's just so painful for me to see that. That, like I saw another day, there's a man in his 40s dying on the floor. There's his father in another room dying in the bedroom without anybody helping them. They both are dying of COVID-19. Just, they say, I cannot breathe. And the father was saying from the bed, he cannot breathe anymore. The son was crying from the city room. He cannot breathe anymore. In fact, they both die in that situation. And some good people found that happen, and they saw that happen to them. Just imagine, that's why they're panic. So, I saw in my own village when I was small, 3 people died. 3 people died from preventable diseases. 3 people. One from the same family. One in the morning, one at lunchtime, one at the evening. Just imagine those moments. I was thinking I could be the next to die. My mom will be the next to die to childbirth. I'll be the next to die to diarrhea. And then that motivated me to become a doctor, actually. That I found out that there should be something that I can do. There could be some good thing that I can bring to my people. Not necessarily a doctor, but I was thinking there must be something. There must be something to do about this suffering and pain and death and destructions. So basically, I was motivated by the suffering and the pain that I have seen in my childhood period. And the worst was man-made suffering. So the military junta right from my childhood, I'm talking about that is some 30 years ago, 32 years ago.
Mm-hmm.
My village, small village, there's no electricity, no running water, no school, no hospital, nothing. But military generals sent their men and women, the soldier, to my village 32 years ago.
Mm-hmm.
And they occupy my village since then till today. It has been 32 years that we have been occupied. And the beginning, I still remember they raping the women in the village. They do forced labor. Everything they do was torture, forced labor, rape. And they bring that fear and that and destruction to the village community. And it has been 32 years like that, occupied by the military junta till today. So in that way, all ethnic states across the country are being occupied by military forces known as the Tamador. The Tamador occupied so many villages, so many communities, only to bring death and destruction, torture, forced labor, rape. So they use torture, forced labor, as weapons. And they do have their battlefield weapon, but the villagers are innocent. They have no weapon, so they have nothing to do. So they start raping, torturing, and forced labor to the people.
This is really a picture of evil and devastation that's being painted on top of a raging pandemic, the Delta variant, the third wave that's sweeping over the country. Have you been given any impression or any idea roughly the kind of death rate or the numbers that we might start to see?
It's a very difficult because all the information are blacked out by the military junta. That's deliberately. They have no data. All the data that they are saying is no one believe, because the dead body are coming to the cemetery. Our cremations are so many. It's just we have to just go to the cemetery or the graveyard to count the dead body. But the difficult thing is many body are being cremated by like in Yangon, and so even there's no graveyard enough, and so it's very, very difficult to know how many are died. But we know that thousands have died. Thousands have died already. And then this is at least we're taking the test is so long. I mean, again, the testing of COVID-19 is very low. Despite of that, there's 35% positive coming. So the next few months, what we can say is half population of Myanmar will be affected by COVID-19. Yeah. So how can we have a country that half population are being affected by COVID-19? So we are 54 million people of population. So in that situation, just imagine, half population will be under the poverty line according to United Nations Development Program. That means 27 million, if it's a half population of 54, will be forced to live under extreme poverty because of this military junta, man-made created humanitarian catastrophe. And 6.4 million people of Myanmar will be without food by end of October this year. And 1.2 million people have been displaced by the military junta. That include, of course, our dear Rohingya brothers and sisters. So how can we manage a country where we have displaced 1.2 million people and 6.4 million people without food and 27 million people living forced to live under the poverty? It's all man-made disasters. It's all man-made suffering and pain and death and destruction. So the only answer is, as I said, international community have to come together as one, and otherwise we will have no country. I really believe so. We will have no country if the situation continue like this.
You mentioned how the pandemic is spreading without any respect for borders or for peoples. This is what diseases do. Do we have any sense of how the pandemic is raging, not just among the people, but among the military and their family as well? We know that their families in the military live very closely together in their bases and their barracks. And do we have any sense of how they're also being impacted by it at this time?
Yeah, it's obvious. I can tell you that many military men and women are also suffering from this pandemic. But again, they need a savior, because these military generals, like Ming outlined, they are now, they commend to their soldier, if you do not kill the people, you will be killed. That's the point. That's the thing that they are saying to their own men and women in uniform. Shoot to kill or be killed. So in that circumstances, so many I can feel as human being, as individual, many military family are breaking down emotionally and socially, and in these pandemic seasons, and then this impact them hugely. They are ordinary soldiers who just love to have a family and who just love to support a family. All they were broken now, is ruined. So military junta leaders, the SAC leaders, SSC leaders, they have, they are not ruining only the life of the ordinary people of Myanmar, but they are also ruining their own children's life, their own grandchildren's future, and the life of the family, the life of the military men and women who are just good people. They like to kill, but they are being ordered to kill. So this is evil. It's very evil.
Do you think there's any possibility or any consideration with having any discussions with members of the military at some level of some kind of temporary cooperation that can just respond to this urgent health crisis?
I understand that international community are engaging some level with minimum engagement with the military junta for practical reasons, like getting permissions to get this vaccination to the country, and getting the travel permits, and all these are just man-made. As I said, it is imposed by military junta in the country. So I also do believe that, and hope and pray, military leaders will realize that this pandemic do not know that they are military generals, and this will kill their family and their children and their grandchildren, and they are destroying the life, not only the people of Myanmar, they are destroying their own life, their own children's future, their own grandchildren's future. So I hope that and pray that they will come to realization that they cannot do this anymore. They cannot go in this direction anymore. And they have to turn back. And they have to surrender their task and hunger for power. That they have to give the power back to the people of Myanmar. And that is the only way how we can manage the situation. Because the power, the sovereignty belongs to the people of Myanmar, not to the military generals. But because evil have no reason, so they have no reason for stealing our democracy. They have no reason to kill the people. They have no reason. There's just no reason with them. There's, all they make is like, they say there's election fraud, but they cannot prove. They say there was 10.4 million voter fraud list in 2020 election, but they cannot prove. They say it was the reason why they take the power from the civilian government, elected government. So I think I hope and pray that they will give up the power and they will give up their act of terrorism against the people of Myanmar. And I hope and pray they will give up their atrocities and crime against humanity that they have committed against the people of Myanmar. That's the only hope that we have. But in terms of, do I see that's happening? No. So for us to be negotiate or dialogue, we need inclusive dialogue. We know we need it, but the condition has to be met. The killing has to stop. Pandemic pause has to be done on the ground. And the atrocity has to stop. So when all those stop, that is the beginning of rebuilding our country.
Thank you for that. And thank you for your time. I know you have a lot of things to get to, and I really appreciate you taking the time to talk about this with us. Before I let you go, I just want to give you a chance to speak to a couple different audiences that are listening in. I'm sure that we have people listening in from Myanmar that, as you said, are going through their darkest time in history, or living through some kind of unspeakable suffering without any support, and are listening to you with a sense of hope, of finding some means of perseverance. I also know that you have members listening of the audience that are outside of the country, that are grief-stricken by what you're saying, that are wishing to help in any way they can, wherever they are, however they find themselves. So I want to give you a chance to speak to these two diverse audiences, those that are in Myanmar, listening to these words, hanging on, those that are outside, that are appalled by what they're hearing and wishing to help in some way. What would you say to those two types of people listening?
The people of Myanmar are brave people and courageous people and generous people, I can tell you that. And so this bravery in the face of the military junta aggression, this courageous, peaceful movement like CDM, protest, strike, boycott, which are more powerful than a military act of terrorism. All this gave me hope to the future for the people of Myanmar. Because of this bravery and this courage, we have hope. When I see these courageous men and women, these brave men and women across my country, I'm proud of her. They are national hero. They are national peacemaker, not only for the nation, but for the whole region. So this is the hope. They were born from these courageous people of Myanmar and the brave people of Myanmar. We need to keep this hope. Our bravery is not just for one day. Our courageous is not only for one day, it's for the rest of our life. And I look, one of the very good proverb, I must call it a proverb, by, Second World soldier, freedom fighter. They say, we gave our life today for yours tomorrow. We gave our today for you tomorrow. So it's a very powerful statement. So the people of Myanmar are sacrificing their life for the future of tomorrow. So I can put it this way. We are giving our life today for a better tomorrow. Yeah, a better tomorrow. So that is the reason why we have hope. So I'm doing now what I'm doing every day. I'm sacrificing my life for a better tomorrow. So I think that is where we are together. That gave her hope, and we must continue to do so. And our unity is our strength. Myanmar is multi-ethnic country, multi-religious country, multi-cultural country. We are like beautiful gardens where so many flowers bloom. We are like a garden of Myanmar where so many tribes flower blooming. Yeah, it's very simple. All that flowers should be accepted of their beauty. We all are the beauty of Myanmar. We all are the pride of Myanmar. We all should be allowed to bloom our colorful flower in our own distinguished way. No other flower have the right to kill another flower, because we all are flower. We all are the trees. No other trees should come and kill another trees that is producing the fruits of love, the fruits of hope, the fruits of health, the fruits of education, the fruits of economic, the fruits of all those fruits we need. So I think we should see all of us as a flower producing something really good to the world. And that is for our people. So we all are flower. We are flower. Soon we will be bloom again. Soon we will be producing the fruits to the future, for tomorrow, for better world, for better place. Okay. There will be a country called Federal Democratic Union of Myanmar. Federal democracy. Why federal democracy? It will be a very important that no more discrimination, no more killing, no more violence, and we'll bring an end to violence. We will bring an end to terrorism, and we will start to build the future where all the rights will be protected regardless of religious, culture, ethnicities, race. Yeah? And the future will belong to everyone. Everyone, all the rights of all will be protected, respected, and promoted. That is the future we are going. And for international community and from outside of Myanmar, what I really want to ask is, please continue to advocate for the people of Myanmar. Please continue to lobby for the people of Myanmar. Please continue to support the people of Myanmar in whichever way you can. And there's a lot of way that the people from outside Myanmar can help the people inside of Myanmar. So I hope and pray that international community and the people from around the world will be the voice for the people of Myanmar. It's like voice for voiceless, the help for the helpless, the hope for the hopeless. So I ask and appeal to the people around the world to please be the voice of the voiceless, to be the help for the helpless, to be the hope for the hopeless. Yeah. And to help us to ease this pain and suffering of the people of Myanmar.
Thank you. Thank you for those words, and thank you for the time that you're spending with us today amid what I know is a very busy schedule. And I know in my heart and my prayers and my metta and that of the listeners that we will be doing and thinking and sending whatever good wishes and taking whatever good actions we can on behalf of helping the Burmese people as they're going through this very difficult time. And I thank you so much for taking the time to join us and answer some of these difficult questions.
Yeah, thank you for having me. Thank you for having me.
After today's discussion, it should be clear to everyone just how dire the situation is in Myanmar. We are doing our best to shine a light on the ongoing crisis, and we thank you for taking the time to listen. If you found today's talk of value, please consider passing it along to friends in your network. And because our nonprofit is now in a position to transfer funds directly to the protest movement, please also consider letting others know that there is now a way to give that supports the most vulnerable, and to those who are especially impacted by this organized state terror. If you would like to join in our mission to support those in Myanmar who are resisting the military coup, we welcome your contribution in any form, currency, or transfer method. Every cent goes immediately and directly to funding those local communities who need it most. Donations go to support such causes as the Civil Disobedience Movement, CDM, families of deceased victims, and the purchasing of protective equipment and medical supplies. Or if you prefer, you can earmark your donation to go directly to the guest you just heard on today's show. In order to facilitate this donation work, we have registered a new nonprofit called Better Burma for this express purpose. Any donation you give on our Insight Myanmar website is now directed to this fund. Alternatively, you can visit our new Better Burma website, which is betterburma.org, and donate directly there. In either case, your donation goes to the same cause, and both websites accept credit cards. You can also give via PayPal by going to paypal.me/betterburma. Additionally, we can take donations through Patreon, Venmo, GoFundMe, and Cash App. Simply search Better Burma on each platform and you'll find our account. You can also visit either website for specific links to those respective accounts, or email us at info@betterburma.org. In all cases, that's Better Burma, one word, spelled BETTERBURMA. If you would like to give in another way, please contact us. Thank you so much for your kind consideration. You've been listening to the Insight Myanmar podcast. We'd appreciate it very much if you could rate, review, and/or share this podcast. Every little bit of feedback helps. You can also subscribe to the Insight Myanmar podcast on Apple Podcasts, Spotify, Stitcher, or wherever else you get your podcasts to make sure you don't miss any of our upcoming episodes. If you can't find our feed on your podcast player, please just let us know and we'll ensure it can be offered there in the future. Also, make sure to check out our website for a list of our complete episodes, including additional text, videos, and other information available at insightmyanmar.org. And I also invite you to take a look at our new nonprofit organization at betterburma.org. There was certainly a lot to talk about in this episode, and we'd like to encourage listeners to keep the discussion going. Make a post, request specific questions, and join in on discussions currently going on the Insight Myanmar podcast Facebook group. You're also most welcome to follow our Facebook, Instagram, and Twitter accounts by the same name. If you're not on social media, feel free to message us directly at info@insightmyanmar.org. Or if you'd like to start up a discussion group on another platform, let us know and we can share that forum here. Finally, we're open to suggestions about guests or topics for future episodes. So if you have someone or something in mind, please do be in touch. We would like to take this time to thank everyone who made this podcast possible. Currently, our team consists of 2 sound engineers, Mike Bink and Martin Combs. There's of course Zach Hessler, content collaborator and part-time co-host. Ken Pransky helps with editing, and a special Mongolian volunteer who is asked to remain anonymous does our social media templates. In light of the ongoing crisis in Myanmar, a number of volunteers have stepped in to lend a hand as well, and so we'd like to take this time to appreciate their effort in our time of need. And we're always on the lookout for more volunteers during this critical time, so if you'd like to contribute, definitely let us know. We'd also like to thank everyone who has assisted us in arranging for the guests we've interviewed so far. And of course, we send a big thank you to the guests themselves for agreeing to come on and share such personal, powerful stories. Finally, we're immensely grateful for the donors who made this entire thing possible. We want to remind our listeners that the opinions expressed by our guests are their own and don't necessarily reflect the host or other podcast contributors. Please also note that as we are mainly a volunteer team, we do not have the capacity to fact-check our guest interviews. By virtue of being invited on our show, there's a trust that they will be truthful and not misrepresent themselves or others. If you have any concerns about the statements made on this or other shows, please contact us. This recording is the exclusive right of Insight Myanmar podcast and may not be used without the expressed written permission of the podcast owner, which includes video, audio, written transcripts, or excerpts of any episodes. Also not meant to be used for commercial purposes. On the other hand, we're very open to collaboration, so if you have a particular idea in mind for sharing any of our podcasts or podcast-related information, please feel free to contact us with your proposal. If you would like to support our mission, we welcome your contribution. During this time of crisis, all donations now go towards supporting the protest movement in Myanmar through our new nonprofit, Better Burma. You may give by searching Better Burma on PayPal, Venmo, Cash App, GoFundMe, and Patreon, as well as via credit card at betterburma.org/donation. You can also give right on our Insight Myanmar website, as all donations given there are directed towards the same fund. And with that, we're off to work on the next show, so see you next episode.
Yeah.